Welcome, everyone. I'm Dr. John Whyte, Chief Medical Officer at WebMD, and welcome to Coronavirus in Context. We're hearing a lot of information about the vaccine, as well as how things might change next year with the new administration. So I've asked my good friend, the former acting chief scientist of the U.S. Food and Drug Administration, and a member of the President's-elect COVID Advisory Board. Please welcome Dr. Luciana Borio.
How are you, John? It's a pleasure to be here with you today. It's great to see you again.
It's great to see you again. I want to start off with, you and I both worked at the FDA, and some people are saying if there's such good data about safety and efficacy for these mRNA vaccines, why go through an EUA and not a full approval? What's the difference that people should know, and does it really matter?
Yeah, that's a great question. Now, first of all, I have to say that I am so incredibly proud of the work that the Office of Vaccines and the staff in the Office of Vaccines have done in the last, several months. They really set the standard for how a regulatory agency ought to support the development in a way that expedites availability, but also is very responsible to the public health. And you may recall that from the earlier days, they communicated to industry very clearly about expectations for what the trials should look like, that it would be important to have really hard clinical trial data from the gold standard, double-blind, placebo-controlled trials. They had to be adequately sized to be able to really detect meaningful differences between the placebo arm and the vaccine arm. So, and that has been really crucial, this development path that we're seeing today that gives us such confidence in the vaccines that we have really wouldn't have been possible without their leadership and guidance.
And Pfizer did announce that they're going to request a full approval, a BLA, in April. But were you surprised that they weren't given a full approval early on? Is it mostly because this is still a new technology? What are your thoughts on that?
That's a very important question, the difference between an EUA and a licensed product. And of course, there are differences. In this case, the EUA, what we know for the EUA, we have that these vaccines are highly effective in the randomized controlled trials. And we have a very good idea of their adverse event profile. What we don't know yet is what is the frequency of potentially rare adverse events. So when you study a vaccine in 30,000 people or 40,000 people in a clinical trial, you may not be able to detect the rare adverse events. And I think it's very important for us to be able to have a grasp on that before a vaccine is licensed. The other thing that sometimes precludes the licensure of a vaccine like this is that we want to make sure that the manufacturing is scaled up and consistent. And the vaccine that is used in the future, licensed vaccine, is going to be the same vaccine that we're actually rolling out today. That is a crucial component of a licensed vaccine, is this confidence in the manufacturing systems. These vaccines, we have, FDA has very good confidence in the doses that are being released, but some of the manufacturing systems are still being, optimized. Some vaccines are being made in different plants. Again, I have full confidence in the vaccines that are being released, but there is a little bit of a different bar for a licensed vaccine.
If you were offered it today, would you take it today?
Absolutely. As a matter of fact, I'm a healthcare provider. I still practice at Johns Hopkins. And last week I received an email with an option to already stand in line, if you will. And I'm not like in the highest priority tier because I do not work in wards where we're treating COVID patients, but I have a lot of outpatient encounters, and my name is on the list, and I'm anxiously awaiting for my turn to get this vaccine.
Now, technically, by law, under an EUA, a vaccine or a drug is still considered investigational. What's your feelings on whether there'll be a push early next year for mandatory immunization? Do you think that's on the radar? Or are we going to use the power of persuasion?
Well, and I'm speaking for myself here, right? So the statute, the EUA statute that governs, the way FDA reviews and issues the EUA, make it very clear that patients, recipients should have the ability to opt in or out of the EUA product. It is an approved product. And also, I think that, the vaccines there's been such care in the development of these products and such transparency around it that I think this information is available to people to make their own decisions. And I personally believe that people should have the autonomy to make decisions for themselves. To me, it's a no-brainer. Everybody really who is at risk for COVID should opt in. And, it's very understandable to have some anxiety around a new technology, a new product. And there's still much that we're going to learn about this product. But it does make perfect sense given what we're seeing with COVID, the way, this disease really devastates people's health for the long term sometimes, and families, communities, the economic impact it has had on our country. Even with these theoretical unknowns about the vaccine, it seems that the benefits greatly outweigh the known risks of getting COVID.
So how do we inspire confidence? I think sometimes, when we use terms like mRNA, which people don't necessarily understand what that is, we talk about, as we just were about EUA, no one knows that unless they know FDA parlance. We're talking about adverse events, all these terms that people aren't familiar with. What are some of the best strategies, as you just talked about, that we can help people evaluate that, benefits versus risk, and understand why they too can have a lot of confidence in this vaccination program?
Yeah, I think so. Communication is going to be clear, honest, transparent communications to explain to people in plain language what is known, what are the unknowns. I think we need to, look for trusted sources of information. And sadly, we're in an environment where there's a tremendous amount of misinformation being shared on social media. It makes it even harder to be able to put forth, the credible sources of trusted information that patients really need to have to make these decisions for themselves. These are not easy decisions, and they should really speak to people that they trust, but also people that know what they're talking about in this instance.
Everyone who has a blog isn't an expert on vaccine development. You've had a global perspective throughout your career, and I wanted to ask you about a report today that talks about low-income countries may not see a vaccination program till 2022. So recognizing the global economy as well as global travel, doesn't that work against the idea of figuring out how we crush this pandemic if some areas of the world aren't going to be able to participate in a vaccination program for more than another year?
That's right. So this is something that really, weighs heavily on, I think, everybody involved who understands how pandemics work and the global nature of them, and how we really, you can't be protected until everybody is protected. And this is something that the Biden-Harris administration is taking very seriously and examining different options to be able to engage in the global community, to be able to have a global effort to combat the pandemic, not just, a domestic.
Do you think we'll have to wait that long, or do you think we'll figure out strategies to get it to them sooner, both logistically as well as being able to immunize a large percentage of the world's population?
Yeah, it will take a while because the global manufacturing capacity for vaccines is finite. And there are some candidates, for example, that can be more easily manufactured, that, very, very large quantities can be manufactured. And if those candidates really shown to be safe and effective, similarly to what, the Moderna and the Pfizer vaccine have demonstrated, I think that will get us much closer to the goal of having a protected Earth, and not just specific countries. But that's something that we're going to have to work. And, there is the good news, I think, it's that there is a strong interest and intent by the new administration, once they are in place, which it does only happen after January 20th, as you know, to engage globally to tackle this pandemic.
You're a member of the transition team as well. What do you think are some of the biggest changes that we'll see next year? As you and I have talked about before, there really has been an attack on science. And what I've seen is that in the past, people would say, I don't understand science. Now, sometimes they say, I don't believe in science. So, what are the changes that perhaps we can expect to see next year in terms of how we communicate about the pandemic, as well as how we all have to participate in these public health strategies to really eliminate the virus?
Yeah, so I think the biggest change will be really to focus on a response that is science-based and fact-based. And the president-elect has made it very clear that, the scientists and the physicians and the public health professionals are going to be developing the plans, and he's going to be listening to them. So that's going to be the major, major difference. And I expect agencies that are science-based, like the FDA and the CDC, to regain their autonomy to be able to develop and recommend what really ought to be done, because they know best. They're experienced. They have thousands of professionals, as you know, working and who's been preparing their whole life to tackle pandemics. And I'm looking forward to hearing their voice again.
Will there be more of a global perspective in terms of how we address health issues in general?
Well, absolutely. The president-elect has made no secret that he really thinks it's going to be critical for the U.S. to re-engage in the global community, that he intends to rejoin the WHO, the World Health Organization, after he's president. So there will be, I expect to see a very different process for how the U.S. is going to be engaging in global health security, global biodefense preparedness, global health. There will be a significant change from what we've seen in the last 4 years.
Well, we see a more centralized process, even in terms of how we think about testing. So it's great we have a vaccination program, but it's also about therapeutics. It's also about testing as well. More testing, more convenient testing. Will we expect to see changes in terms of a testing strategy?
Yeah, I do expect that for areas where a more centered coordination is essential, that we will see leadership, willingness to take ownership to do so. So, for example, you mentioned the national testing strategy. There's so many diagnostic tests out there. There's so many different algorithms that can be used be used to deploy effective testing strategies, depending on what people are trying to do, diagnose, a sick patient, or reopen a school, or do surveillance in a workplace. And the idea that we need a national strategy to be able to inform, all levels of government and public health to how to best deploy, these important assets that we have. It doesn't work so well when each locality is left to make its own decisions and develop its own testing strategy. So again, I think that for areas where this kind of central coordination really does help, we will see leadership willingness to own the problem and to work with state and local officials to be able to support them and to guide them, instead of, in contrast to just leaving things to different localities, which really doesn't help anybody. We hear loud and clear also from the device manufacturers, the diagnostic test manufacturers, that it's very difficult for them to respond in the most robust, effective, efficient way when there is this federated system across our big country.
You've dealt with emerging threats much of your career. So what are the lessons that we've learned? I mean, you've dealt with addressing Ebola, SARS, other viruses. What can we take from our experience in addressing COVID-19 to prevent a future pandemic?
Yeah, so I think that it's important to lead with science. It's important to lead with integrity. And we have to deal with the facts as they exist, not the way we wish they would be. So the pandemic is very real. The pandemic is killing so many around the world. But sadly, in America, in our country, it's really causing a tremendous amount of pain and hurt, both in terms of health and economic stress for so many of our families. And it is really critical that we tackle it, with our best tools. Every pandemic is going to be different. Every one of these emergencies will require, a different, slightly different approach, but the fundamentals don't change. It's science, transparent, honesty, courage, responsibility. And that's what I have for you today.
Well, thank you. And finally, I'm going to, before I let you go, I'm going to ask you for a prediction. How do you think things will look 6 months from now?
The future is bright, and it'll look much better than it is, than this, this dark winter we have today. I'm looking forward to the spring and the summer. Not only are we going to have a government that is going to tackle this in a most serious way, but I'm looking forward to more vaccines becoming available. And I just can't wait to be able to, go outdoors again and see the American people smiling and happy that this is almost behind us.
Well, Dr. Borio, I want to thank you for taking time today to provide your insights. I know you have a lot on your plate addressing the pandemic, and I hope we can talk to you again in the near future.
It's such a pleasure to be here. Thank you for having me.
And if you have questions about COVID-19, send them our way. You can send them to Dr. John at WebMD.net, as well as on our social, Instagram, Pinterest, Facebook, and Twitter. Thanks for watching.